honorable expert of the session, deans, academic directors, faculty members, and my dear students. Good morning, one and all. Today's topic is gender equality. So, this is not only a fundamental human right, but it is a foundation for peaceful, prosperous, and sustainable world. There has been progress over the last decades. More girls are going to school, fewer girls are forced into early marriages, more women are serving in parliament and positions of leaderships, and laws are being reformed to advance gender equality. So despite these gains, many challenges still remains. Discriminatory laws, social norms remain pervasive. Women continue to be underrepresented at all levels of life. In and also one in five women and girls between the ages of 15 to 49 report experiencing physical or sexual or any other type of violences or harassments from their intimate or partner or colleagues or any other within the 12 months period. So, to elaborate more on this, we will be having today the great personality, Dr. Nirja Sood, Academic Counselor, Program and Course Coordinator, Indira Gandhi National Open University. So, I'm very happy to introduce Madam. Very shortly, due to the time constraint, I'm making short. Sorry for
Yeah,
this.
it is. It is.
So,
No
Madam has
need. No need to give long introduction, please.
I'll make it short, ma'am.
Yes, just
Madam
in
has
two, three
done
lines you complete it.
Sure, ma'am. Madam has done the BSc Honors in Nursing from the Delhi University in 1984 and Masters in Nursing, and also postgraduate diploma in distance education, postgraduate diploma in bioethics, and also MPH from the Jawaharlal Nehru University. And also, Madam has done the PhD in the year 2019. And Madam is the FAMA Fellow since 2012 to 14. And almost totally, Madam is having 44 years of experiences and in various teaching learning activities, being a course coordinator and administrative leadership roles. And also a vibrant experience in the research by conducting research as well as guiding the UG, PG, and uh, other research activities in the national and regional levels. And also, Madam has involved in the course design, development, maintenance, and program course coordination in the teaching also. And Madam was many times resource person for a number of programs, conferences, workshops, and any other government run programs. Also published many research articles and
Thank you
in
so.
the reputed journals, and um, invited as a speaker for many of the conferences. With this short introduction, I am welcome you for the session. Over to
Thank
you,
you.
madam.
Thank you so much. Still a very elaborative introduction. I am really obliged for that. And first of all, I would like to give thanks to you for giving me an opportunity to be associated with your college after a long time. And it's
Thank
always
you, ma'am.
nice to be associated. I will just share my screen and start the presentation.
Yeah, sure.
Is it visible, my presentation?
Yes, ma'am.
You have rightly given the introduction about the gender equality. Before I start my session, I would just like to give the overview. First, I'm just going to give you a brief introduction, meaning of some of the important terms. Then, what are the various declaration, conventions, and commissions which are been established and formed? Then, gender equality and SGD targets, gender equity and health, and global gender gap index, which will actually give you a vision what is the scenario not only in our country but all over the world. So Gender equality is a goal that has been accepted by government nationally and internationally. It is included in international agreements and various commitments which most of the countries are signing. And there are many ongoing discussions about what equality means, what it does not mean in practice, and how to achieve it. That is a big challenge. It is clear that there are global patterns to inequality between women and men. For example, women tend to suffer violence at the hands of their partners. Women's political participation and their representation in decision making is still less than men. Women and men have different economic opportunities, and overrepresentation of women among the poor categories in the socio-economic status. Women and girls make up the majority of human trafficking and involved in the sex trade. With this introduction, I would like to give some of the important terms and their meaning. What do we mean by gender? Gender, a social and cultural construct which distinguish differences in the attribute of men and women, girls and boys, and accordingly, roles and responsibilities are being given to them. Gender-based roles and other attributes therefore change over time and it varies along the cultural context. You must have seen this even in our own country. Gender bias. Making decisions based on gender that result in favoring one gender over the other, which I think all of you must have observed in your families, in the communities, and in the various sectors of the society. Next is gender disparity. Statistical differences, often referred to as gap between men and women, reflecting an inequality in some quantitative form is given. Gender equality, the concept that women and men, girls and boys have equal conditions, treatment, and opportunities for realizing their full potentials, human rights, and dignity, for contributing in the economic, social, cultural, and political development. This is meant by gender equality, that they have equal conditions. But over the presentation, you will see still there are many variations. Some declarations, conventions, commissions related to gender equality. Beijing Declaration and Platform for Action in 1995 emphasizes comprehensive commitments to women under 12 areas, that is, poverty, education, training, health, violence against women, armed conflict and economy, power and decision making, institutional mechanism, human rights, media, environment, and the girl child. You can see almost all the areas are being concerned, and there was a concern regarding the human women equality. Convention on Rights of Persons with Disability, that is CRPD, in 2006 included the need to incorporate a gender perspective in all efforts to promote the full enjoyment of human rights and fundamental freedom by persons with disability. So even the gender perspective from the disability relationship has been a concern of this convention. Convention on Rights of the Child in 1989, the legal framework includes all fundamental rights treaties with provisions confirming the principle of non-discrimination and equality between men and women. Commission on the Status of Women in 1946, you can see the global intergovernmental body exclusively dedicated to the promotion of gender equality and empowerment of women. You can see it was long back in 46. In 2016, this commission passed a resolution on women and girl child and HIV and AIDS. In 2017, the Commission urged government to mainstream gender perspective in education and training, including science, technology, engineering and maths, the STEM in short, develop gender-sensitive curricula, eradicate female illiteracy, and facilitate girl and women effective transition to work. Girls with disability and their right to education are also included. So over time, you are seeing that even the commissions are widening their scope for the gender equality in the various aspects. Convention on the Elimination of All Forms of Discrimination Against Women, adopted in 1979 by UN General Assembly, described as an international bill of rights for women. Even India is part of various commission convention and adopted the international declarations. This convention defines discrimination against women as any distinction, exclusion, or restriction made on the basis of sex, which has the effect or purpose of impairing the recognition, enjoyment, or exercise by women, irrespective of their marital status, on the basis of equality of men and women, of human rights and fundamental freedom in the political, economic, social, culture, civil, or any other field. But in reality, you must have observed, and we will also see how the reports are saying still there are inequalities in all these aspects. Now, gender equality and sustainable development goals, in short, it is known as SDGs. Gender equality. Already we have said gender equality is the equal valuing by society of the similarity and differences of men and women and the role they play. It is based on women and men being fully partner in the home, community, and society. Equality does not mean that women and men will become the same, but the women and men's right, responsibility, and opportunity will not depend whether they are born male or female. I hope this is clear to you what do we mean by gender equality. Gender equality implies that the interests, needs, and priorities of both men and women are taken into consideration, recognizing the diversity of different groups, and all human beings are free to develop their personal abilities and make choices without the limitation or stereotype about gender role. Gender equality is a matter of human right and is considered a precondition for indicator of sustainable people-centered development. Internationally, communities agreed in 2015 on 17 Sustainable Development Goals. I hope all of you know these Sustainable Development Goals. Sustainable Development Goals reaffirm UNICEF work on gender equality, especially around the rights and empowerment of adolescent girls and women. The need of rights of girls are given in Goal 5 of SDG, that is gender equality and women empowerment, and cut across the 2013 Agenda for Sustainable Development. Goal 3, that is our good health and well-being, it emphasizes to reduce maternal mortality, preventable deaths of newborn, child under 5, ensure access to sexual and reproductive health, and HIV and AIDS and other diseases. Goal 5 is related to quality education. Universalize access to quality education at all levels with a mandate to redress social inequalities undermining access to educational opportunities. Eliminate gender disparity at all levels and making sure education facilities are gender sensitive to create effective learning environment. General Assembly resolution noted that the equal rights of girls to quality education is central to Sustainable Development Agenda. Goal 6, a very important again, social determinant of health, that is clean water and sanitation, specifically call for paying attention to the needs of women and girls. Globally, nearly 15 million girls under the age of 18 are married early years, or 37,000 every day. Marrying young also affects girls' education and the health also. About one-third of developing countries have not achieved gender parity in primary education. It stands true for our country also. In Sub-Saharan Africa, Oceania and Western Asia, girls still face barrier to entering both primary and secondary school level. Gender equality is a fundamental human right, rightly said by Vinaya in the introduction. Gender equality is critical to all areas of a healthy society, from reducing poverty to promoting the health, education, protection, and well-being of girls and boys. You can see gender equality has impact on the overall development of the human being, society, community, and family. Investing in educational programs for girls and increasing the age at which they marry can return $5 for every dollar spent. Investing in programs improving economic generating activities for women can return $7 for every dollar spent. You can see how cost effective, how productive, and what is the return in the form of investment if gender equality and investment is done in the girls and women education and the health programs, and economic activities are being increased. Gender inequality. How does gender equality affect the woman? Disadvantages in education translate into lack of access to skills and limiting opportunities in the labor market. Because most of the women you must have seen even on the roadside, they are laborers. They are doing hard work. They are working in the agricultural land. They are work because inequalities are there. They are not being educated. That's why the limited opportunities in the labor market are there. Women and girl empowerment is essential to expand economic growth and promote social development. The full participation of women in labor force would add percentage points to most national growth rates. So if we want to have good national growth rate, women education is very important. What happens if gender equality is not ensured? Inequalities faced by girls can begin right from the birth till the time they are living. In some countries, girls are deprived to access health care or proper nutrition, leading to higher mortality rate. As girls move into adolescence, gender disparity widens. Child marriage affects girls more than the boys. It stands true even in our country. Still, girls in many societies, in many parts of the country, are especially in the poor families, low socioeconomic status, even in the middle class, also in some of the high income families, they are deprived of equal rights as given to the boys. Girls are married early. Teenage pregnancy is an issue. Mortality and morbidity is very high. Gender equity and health. Try to understand this. What is gender equity? Gender and its relation to disease, risk, access to services, and impact on health outcome is what the action is required at this time. Gender equity is access to services and health outcomes is what we want to achieve. At present, if you see, health outcomes are not very good in the women. Still, maternal mortality is very high. Morbidity, if you see during antenatal, postnatal, and other problems, HIV, AIDS, non communicable diseases are still high. But we want to achieve this to have access so that they have access to services and health outcomes can be improved. Equity ensures that women and men have the equal chance not only at the starting point at birth but till the time they are alive, till even at the age of 70, 80, or when they are elderly. It is about the fair and just treatment of both sexes that takes into account the different needs of men and women, cultural barriers, and discrimination of specific group. Equity is used, for example, within the education, health, humanitarian sectors, referring to equal distribution of resources based on the need of different groups of people. Gender equity in this context refer to the fact that a gender analysis of these needs is necessary as they in many respects may different for women and men, girls and boys. Gender equity is about ensuring that everyone has the opportunity to attain their full health and well being according to their specific and respective needs, with no one has disadvantage due to gender, that is, they are male or female. In practice, this may involve individual being treated in the same way or differently. You must have seen in many families, women has no right to decide about their health, when they need treatment, where they have to go for the treatment, how much money they can spend. So the gender equity is very important. So they also have the opportunity to take decision about their health and well-being. Gender equity is a key determinant of health and well-being. It makes a fundamental difference to who is at risk to disease, who can access the services they need, who live or impacted, that is socially and economic, and to what extent. Understanding the gender based factors, it can be socio, cultural, economical, that not only affect people's vulnerability to ill health, but their ability to seek and benefit from prevention, testing, treatment, care, and support. Ultimately, such an approach shapes the impact of a response in terms of case prevention, treatment, mitigation, and the lives are saved. So it's very important to see everyone, irrespective of the gender, irrespective of socio-economic status, they get the best services, basic preventive package services. A gender equity approach can take advantage of the synergies across HIV, TB, and malaria. Example of these include how gender is affected family decision making about healthcare, such as what I was telling you, when to access care, who is to prioritize for the treatment, community expectation for caregiving, such as with women and girls bearing a disappropriate burden. You must have seen in every family when someone gets sick, it is the mother, wife, sister, or the female person who is responsible to take care of the sick person. And key population barriers to mainstream services such as stigma and discrimination by healthcare professionals. More than half of the new HIV infections are now among the key populations and their sexual partners. Transgender women are 12 times more likely to acquire HIV than members of the general population. Gender equity is relevant to the entire HIV care, that is, prevention, testing, treatment, care, and support. This starts from whether someone can or is able to access preventive information, use of condom, or have a HIV test. For example, program implementation experience shows that among key populations such as sex workers or transgender women, a high prevalence of violence is linked with the high rate of HIV infections. Women living with HIV also experience intimate partner violence and significantly less likely to start or adhere to ART. That is why the clinical outcomes are not good. Meanwhile, overall gender factor contribute to men being less likely to access HIV testing or to seek, use and adhere to ART, and being more likely to have lower cluster of CD4 count at treatment initiation due to late diagnosis. Gender equity and TB. Gender is increasingly recognized as a critical dimension for understanding and responding to tuberculosis also. Nearly 60% of new cases occur among males, reflecting gender pattern in societies and culture, such as those related to high-risk occupation and poor health-seeking behavior. However, a deeper analysis reveals complex dynamics on risk and access to services. Because there are political, economical, social factors are also associated. For example, TB in pregnant women living with HIV increases the risk of maternal and infant mortality by about 400 times. Key and vulnerable population. TB includes groups such as prisoners, migrants, refugees. Indigenous population often face social marginalization that is compounded by gender. Some occupations such as mining, often associated with crowded living conditions, can make men at higher risk of tuberculosis, while a similar risk factor is faced by those working in the garment industry or living in peri-mining communities and crowded factory dormitories, the majority of whom are women. So you can see the gender disease pattern is also very important to understand when you even do studies and go to the community. Overall gender is an essentially critical factor in identifying the estimated 4 million missing people living with tuberculosis who go undiagnosed, untreated, unprotected every year. Key and vulnerable population always face intense social marginalization, which is compounded by the gender disparity. Now, the pregnant women are more vulnerable to malaria. You must have studied various studies also which have shown this, which can cause severe anemia and death. While significant efforts has been taken to integrate malaria into antenatal care, as well as efforts to improve access to antenatal care. According to WHO, only 90% of women receive the recommended 3 doses of intermittent preventive treatment during pregnancy. You can see what is the scenario in the countries. Now, the very important, this is a latest report. I thought let me give some of the global gender gap index also so that you can understand what is the situation globally. Global Gender Gap Index benchmarks the evolution of gender based gaps among 4 key dimensions. These 4 dimensions are economic participation and opportunity, educational attainment, health and survival, and political commitment. You can see this report emphasized. This is 2021 report. It is the latest report. It says it will take around 135.6 years to close the gender gap worldwide. So you can see where we are standing at present. Across the 156 countries covered by the index, women represent only 26.1% of some 35,500 parliament seats and just 22.6%, that is over 3,400 ministers worldwide. So you can see even at the political level, people who make the decisions for the countries, their also representation of women is still very less. This is a global scenario. In 81 countries, there has never been a women head of state as on 15 January 2021. At the current rate of progress, the World Economic Forum estimated that it will take 145.5 years to attain gender parity in politics. So we have to wait for 145 years to see politically there has to be a gender parity, and what to say about then about the other at the community level. A gender gap in economic participation and opportunity remains the second largest of the key four gaps traced in the index. It will take another 267.6 years to close the economic participation and opportunity gaps. This is a grave situation. If women are not economically strong, they are not participating, and opportunities are less, how the SDGs can be achieved and how the country can progress. On one hand, the proportion of women among skilled professionals continues to increase, as does progress towards wage equality is at a slower pace. That means one side, women or girls are educated and they are skilled professionals, little bit it is increasing, but on the other side, the wages given to men and women is decreasing. On one hand, overall income disparities are still only part way towards being bridged, and there is a persistent lack of women in leadership positions, which representing just 27% of manager positions. You must have seen in most of the companies, the management positions in hospitals, in various big, you can say multinational, it is the male dominating. Only 27% in management position. Gender gap in educational attainment, this report says this is nearly closing the gap. The last mile progress is proceeding very slowly. This index estimate that it will take another, this is still a very good condition, 14.2 years to complete the gap. But still in our country, if you see country wise, still it will take time. For both education and health, while progress is higher than the economic, politically, and global data, there are important future implications of disruption due to pandemic. You must have seen during COVID pandemic also, education and the health sector has been disrupted very badly, as well as continued variation in quality across income, geography, race, and ethnicity. Early projections from International Labour Organization, that is ILO, suggest 5% of all employed women lost their job, comparing with 3.9% of employed women. Whenever there is a attrition or people have to see that how they can be cost effective, first target is the women. Women lose more job than the men. LinkedIn data shows a marked decline of women's hiring into leadership roles, creating a reversal of 1 to 2 years of progress across multiple industries. While industries such as software and IT services, financial services, health and healthcare, and manufacturing are countering this trend. That is, more women are entering in the software, IT, financial, health, and manufacturing sector. There is a more severe destruction of overall roles in the industries with higher participation of women, but in the consumer sector, non-profit, media, and communication, this sector is still have a variation, and they are going down not for not employing the women. IPOS, Ipsos, that is Institute de Public Sandes de Opinion Sector. It is a multinational market research and consulting firm. Ipsos data from January 2021 shows that a longer double shift of paid and unpaid work in a context of school closure and limited availability of care services has contributed to an overall increase of stress, anxiety around job insecurity, and difficulty in maintaining work life balance among women with children. You must have also observed during COVID pandemic, women has to do household work. If they were working, they have to do their office work and they have to look after their families or all the needs because everyone was at home. They had double burden and it was really very stressful to maintain work life balance. COVID-19 crisis has accelerated automation and digitalization and labor market disruption. I think this is very common in most of the organization due to IT technology and digital technology. Labor market has altogether changed. Many people have lost job, many are doing from home, their perks are being cut. Only 2 of the 8 track jobs of tomorrow clusters have reached gender parity by most show a severe underrepresentation of women. Most of the report shows in every sector, the labor market, women are underrepresented even after COVID. Gender gaps are more likely in sectors that require technical skills. In cloud computing, women make up to 14% of the workforce, in engineering 20%, and in data and AI sector 32%. Following the Middle East and North Africa, South Asia is the second lowest performer on the index with 62.3% of its overall gender gap close. The projected time needed for this region to close gender gap is estimated 195.4 years. Within the region, a wide gap is there that separates the best performing countries. Bangladesh, which has closed at 71.9% of the gender gap, from Afghanistan, which has only closed 44.4% of the gap. India is the third worst performer in the region, having closed 62.5% of its gap because of its large population. India's performance has an impact on the region's overall performance because India is a very big country and the population is very large. 0.65 billion women in India widen its gender gap from almost 66.8% closed 1 year ago to 62.5 this year. You can see hardly there is a difference. In addition, only Bhutan and Nepal has demonstrated small but positive progress. One of the most pressing areas for advancement for South Asia is the gender gap on the economic participation and opportunity subindex, where only 33.8% of gender gap is closed, the lowest globally. Within the region, there are countries where economic gap are even wider. In Afghanistan, has only closed 18% of its gender gap, which is over 45% points lower than the regional country, that is Nepal, which has covered 63%. Three other large countries in the region, that is India, Pakistan, have only closed 31.6 to 32.6% of the economic participation and opportunity gap, and Bangladesh 41.8. Economic gap in these two countries are even widened when over 1 year India scored declined by 3 percentage points and Bangladesh by 2 percentage points. You can see already previously also when I told you the economic participation of women is still not good in our country. So the data, the global gender index in the form of the percentages, you can see it is clearly indicating what is the situation of the gender equity and equality in our country. Lack of progress on women's labor force participation hinders economic opportunities for women. Only 22.3% women in India, 22.6% in Pakistan, and 38.4% in Bangladesh are active in the labor market. On average in the region, the women labor force participation rate is 51% of the male labor force. In Nepal, however, over 85% of women participate in the labor force. Gender gaps are equally large or more in segments of the job market requiring higher skills. The region average share of professional and technical roles taken up by the women is 32.6%. In India, only 29.2% of technical roles are held by women. And in Pakistan, this is only 25.3%. In Afghanistan, 19.3%. The presence of women in senior roles is even more rare. Women make up just 4.1% in Afghanistan, 4.9% in Pakistan, 10.7% in Bangladesh, and 14.6% in India. Already I have told you previously, the managerial positions are headed by the male. Gender disparity again appears in the managerial role and leadership roles. As a result, the disparity in income between men and women is largely in most countries. In Pakistan and Afghanistan, the income of an average woman is below 16% of that an average men, and while in India it is 20.7%. Only in Nepal and Bhutan, the gap is lower than 50% of an income earned by the women is 74% and 58% of that of a men. So you can see in many aspects that Nepal is doing much better than other South Asian countries. Gender gaps on political empowerment, which already we have seen previously also. Sub-index across the region has further widened. Only 28.1% of this gender gap has been bridged till date from 38.7% reported in the last report. The decline in the share of women among ministers in some of the most popular countries explain there is a regional decline. In India, the share of women ministers decreased from 23.1% to 9.1%, and from Pakistan from 12% to 10.7%. But over time in some states, it is slowly increasing also. Women retained underrepresentation in the political sphere. If no country is the share of women in the in no country the share of women in parliament is above 33%. In the three most populated countries, the share lies between 14 to 20%. In some countries, it is low as 5.5%, like in Sri Lanka and Maldives, 4.6%. On the positive note, women have held head of states position at least once in past 50 years in 5 to 7 countries in this region. And in Bangladesh, women have held position office of head of the state longer than men. You must have seen that is the situation in Bangladesh. Only Afghanistan, Bhutan, and Maldives have never had a women head of the state in the recent history. Progress is relatively more advanced in terms of education attainment, where 93% of the regional gender gap has been closed, yet differences remain across countries and across education level. Female literacy rates are as low as 53.7% in Afghanistan, 65.8% in India, 59.7% in Nepal, 57% in Bhutan, 46.5% in Pakistan, and little sign of closing in the near future. We have seen there also they have given 14.2 years is required to fill up this gap. The hope of closing educational gender gap lies with the younger generation, but it is not true everywhere. While in 5 to 7 countries in the region, at least 98% of the gender gap in primary enrollment has been closed, in Pakistan and Nepal, only 84.1% and 87% of gap has been closed. Ensuring across education for young girls, it is essential precondition to equip future generation of women with the tool to be included in the all levels of society at same level as women. Education is very important. Already we have seen in the previous slides. Aspects that limit faster progress or gender parity in South Asia is health and survival. Only 94.2% of the gap of this sub-index has been closed till date. Low performance of large countries such as India 93.7%, Pakistan 94.4% can be traced to be persistent of son preference and sex selection practices, preventing a faster evolution towards parity on this dimension. This is very common irrespective of the socio-economic status in the country. These are some of the important references. I will request the organizers to share the presentation with the participants so that they can go through it. Very good references are there. It will be very helpful for them. I hope the gender equality, gender equity, and what is the situation globally in South Asian countries and India is clear. This presentation has given you a view what is the need of today and the future, and there are some important research areas are also you can identify from this presentation and further can do research and bring in evidence, because in our country also situation in the state varies. Like in the countries the situation varies, our country is very large, the situation varies in the country in the various states according to their socio cultural economic status and the vision of the political decision makers and the administrative decision makers. I hope you are able to get a view what do you mean by gender equality, gender equity, and what is the status today and how much time is required and how it will impact the progress of the country and how it will hinder the progress to achieve the sustainable development goals. Thank you for the opportunity once again to the organization, to the College of Nursing, and Vinaya, thank you for contacting me, and I am really grateful. It was a great opportunity even for me when I was going through this report. It was an eye-opening experience for me to learn so many things. It's open for the question in case there is any question. Thank you so much.
Thank you, ma'am, for an excellent deliberation. So you had narrated in a very excellent extensive manner the problem which we are facing in our country throughout the states a different way. Though we have achieved literacy or education comparing with the previous past,
Yeah.
so there are a lot to achieve in the future
Yes.
also. So if any discussions or any queries from the participants are, you can put up.
I think you can share this presentation. There are good references. They can go through this later also.
Yeah, sure, ma'am. I'll do it.
Yeah.
There'll not be much questions, ma'am.
Yeah, this
So-
is Facebook. You are having no issues.
Because
They can go through it. In case
Yeah, ma'am.
there is something, they can contact me, send me even the email message. I will try to reply to that.
yeah, sure, ma'am, sure. So I think education is one of the stepping stone for achieving this gender equality.
Yes.
Am I right, ma'am?
Yes, gender.
Thanks a lot, ma'am, for,
Education is very important. Yes.
So that they will be able to financially independent and thereby little can be reduced.
Yeah,
with this
gender
inequality.
education and the opportunities in the labor market is very important.
Yeah, ma'am.
Then
Though there are a lot of challenges.
yeah, challenges are there. That's why in our country, every state have their own challenges. Every state have their own challenges. Regional variations are more in our country.
Yes, ma'am. Diversity.
Yes.
So anything you would like to add, ma'am, to this? Or
I think I
shall
have
we
already-
conclude?
Yeah, please.
Dr. Neeraj Sood for being the resource person and sharing the valuable time with us. Thank you, ma'am.
Thank
And
you
also,
so much.
I also thank management support to conduct this event. Also, my heartfelt thanks to Dr. Ravindra Hechan, Principal, Parul Institute of Nursing, all HODs and faculty members of the timely support and cooperation. I extend my gratitude to the IT department and staff of PO for the technical support. Once again, thank you all for the cooperation. Have a nice day. Thank you, ma'am, once again.
This your recorded session is there at the Facebook also?
Yeah, ma'am, it is recorded.
In the same link, on the same link
Same.
which you have shared. Okay, thank
Yes,
you so
ma'am,
much.
yes.
Thank you so much.
Thank you, ma'am.
Thank you.
Nice to meet you. Thank